Welcome to the latest printed press. I'm Aisha Jamal, and I'm very happy today to be hosting yet again a special Wednesday program, which is specifically on COVID-19 and the platform group that we have created amongst us within the Turkish Cypriot community. Today, we're going to be talking about protection, again, how we can protect ourselves during this pandemic, vaccines, and coping with bereavement and the new burial procedures. And I'm very happy to announce that we've got Erim Metto again with us tonight. Welcome, CEO of the Turkish Cypriot Community Association. Welcome, Erim, to my program.
Thank you.
And we've got Dr. Fulya Yahioglu, who is the Senior Public Health Commissioner. Welcome, Fulya. Nice to see you.
Welcome. Hi, everybody.
And of course, we've got Hussain Hashim Bakayi, who is the chair of the Cyprus Islamic Association. Thank you very much, Hussain Hoxha, for coming on my program.
Thank you, and salam alaikum.
Yes, to everybody. First of all, if we could just have you introduce yourself one by one to our audiences, that would be really helpful. Starting with Erim, if you could just give us a bit of background knowledge about yourself.
I'm the CEO of TCCA, which means I manage the organisation day-to-day activities. On the 23rd of March, when we found that the current situation was going to become quite serious, we set up a group, and I'm kind of leading on some aspects of that group. And the group is there to support the most vulnerable within our community and be reactive to what is happening day in, day out. So that's who I am, and just here to kind of provide information and knowledge and what the needs are.
Yeah, and you've been a great support for our program. Thank you. I mean, you're coming on most weeks and organising different individuals from our COVID group. So thank you very much for all the help that you've given us as well from here, from You're Against TV. Fulya, could you give us a brief description of your background, please, for our audiences?
Sure. Before I do, I just wanted to thank those in the community who are striving to help those that are less fortunate than us and who are vulnerable. I think you guys do a fantastic job, as well as the NHS, the care workers. I don't think they get enough recognition, and all the other key workers who are keeping us on track. So just to say a big thank you to them. My background, basically, I work in the public health team for a local authority. I commission services, clinical services for two large NHS trusts. I've worked in the community before. I've worked with Erim quite a bit previously, some really good times. And my previous life, I was a scientist, postdoctoral research scientist. So I worked at the St. Bart's and Royal London Hospital in the clinical biochemistry department, and I was doing research on angina, so cardiovascular disease, trying to look at assays, determining how you can pinpoint kind of when somebody has a heart attack. So I have that background, and hopefully I can provide some guidance. I'm no expert, but I can just, if I can help and reassure people, that's what I'm here for.
Of course. Thank you very much for coming on our program, and your expertise is very much valued. Thank you. And lastly, but definitely not least, Hussain Hoxha, beacon in our society at the moment. Can you give us a little bit background of what you're doing?
Hi, thank you, Aisha, Erim, and Fulya. Yes, and all those who are watching us today, I'm Hussain Hashim Bakayi, chair, founder of Cyprus Islamic Association, also founder of Al Hashim Trust, which is one of the biggest Turkish Cypriot charities that works across the globe. Since the lockdown, our work has been to help organising, unfortunately, the sad arrangements of burials for those in our community and the wider community of those who have passed from COVID and those who are passing from normal deaths as well. So it's been quite a challenging experience. Very emotional experience as well, and thanks to all the organisation, associations, everyone's got together to really put their hand out and help us all during this very, very tiring and very trying period of time we're in.
It is, and thank you also for all the work that you're doing for the community. You've been, like I said, a beacon to our community, not only actually dealing with families, bereavement and burials, but also reassuring everybody and making sure that although we can't have group gatherings and prayers, that you're actually doing that for us, you know. So that's a great help and a real reassurance for those families who've lost loved ones, you know, in these tragic times, really. Going back to Erim, if we could just talk about the current status of the group, what is changing in what the group is doing? Because I think that's quite important.
Yeah, I mean, initially when we first started the group, the fundamental issues were that the elderly and the vulnerable were asked to remain at home for a period of 3 months. That caused the enormous problems, because if individuals who are isolated can't go out to get fundamentals of what they need to live, then obviously that's an issue. So we decided that we was getting reports in that individuals were isolated. They didn't know what numbers to call. They didn't know how to make arrangements. So we stepped in. It started off with a few volunteers. We set up a group, and the group kind of grew, and individuals jumped on to support what we was trying to do. Now, what was the initial context of what happened was that food runs were essential. So we ensured that people had food on their table and the essentials to be able to live day in, day out. We provided an emergency number, which if someone couldn't communicate in English and they wanted someone speaking Turkish to tell what the issues were so that person could act on their behalf, we arranged that as well. We also arranged a platform where people can share information. And finally, we set up a GoFundMe site to fund a lot of the activities that were on there. What's changed now in the last 3 to 4 weeks is that we are managing to get individuals which have come through to us to local authorities. So local authorities will take on the food runs. Local authorities will take on certain degrees of responsibility. We, as a group of people, also found out what the legislative requirements are to access those items that are needed, and also to ensure that medication where needed from pharmacies is forwarded directly to individuals' homes. We're also now moving towards a more of a more of a kind of a befriending scheme that kind of looks after and ensures that there's a contact with individuals who are remaining home. And we're also finding and looking at new ideas to deal with mental health, because people being stuck in day out within a home environment is causing enormous problems in relation to mental health. So in effect, as an organisation, we are reacting to what happens, and we're relying upon volunteers. Everyone that's part of the group is a volunteer. Everyone that inputs into it is a volunteer, and they do it all out of the goodness of their hearts. So that's where we are at the moment. What we're also noticing is we're getting some requests coming in, and the community is stepping in to kind of fill those gaps. One request was an elderly lady, vacuum cleaner broke down, enormous commotion for her in her home environment. So we put a request out for someone who might have a second-hand vacuum cleaner to deliver it to the address. And kindly, we had one of the group members, volunteers, who purchased a new one and ensured it was delivered to the house. So that's an example of how the community is coming together to make sure that those most in need are supported.
That's right. Yeah, it's fantastic. I heard about that story as well, because we're in communication with each other, because I'm part of that support group, and it's really nice to hear and refreshing, really. It's lovely. We're getting some comments in. Before we go on to my next question, Sue Anto is saying, Sue, my dear friend, saying thank you for doing this program, Aishin. Deniz Gül, Yayınla, which means good broadcasting, and Fatma Hassan Taner is saying the same as well. So we're getting a lot of support from the outside. Obviously, it's a very needed program to have your expertise and tell us what's going on in the community. Fulya, my next question is about protection and protecting oneself. How can we protect ourselves from getting the virus? Masks are useful, visors, gloves, but can we go into a little bit of detail about how useful all of these things are? Oh, she's frozen. Hello? Fulya. Okay, we'll come back to her then. Right, we'll go on to Hussain Hoxha, and a question for you. I mean, obviously, during these extremely hard times, our community is having to pull together, and you're supporting the community. How can we help each other through these times?
The best way to help each other, as mentioned by Erim, there was a GoFund, and there's many different kind of charitable appeals at the moment. So we've got one charitable appeal for families who can't afford burials. We also have one for purchase of a new ambulance that will be given as a trust to Shakro Lane Mosque, Ramadan Mosque, which, as many Turkish Cypriots know, is the first established, not only Turkish Cypriot mosque, but Turkish mosque. And it's been one of the mosques that's dealt with most of the COVID-19 deaths within our community. Yesterday, the numbers of known people from the Turkish Cypriot community was about 80. Today it's risen to probably about 86, 87. We'll probably reach higher numbers in the next few days, unfortunately. So one thing we can do is look out for these appeals. We have an appeal for a young lady who died, 26 years old, who was a carer. There are many appeals. The blessed month of Ramadan is coming. It's a good time to reflect and give in charity. Let's all together and do our part. Most of all the other organisations and Turkish Cypriot associations across the board have really been helpful. They're communicating with each other. They're communicating with Cyprus Islamic Association, with the mosque. There's lots of things going on at the moment in the background, many big things. One is the repatriation of our loved ones to Cyprus, which we can discuss in a few minutes.
Yes, definitely. I think we've got Fulya back. Fulya, are you back with us?
Yes, I am. So sorry.
Fantastic. I'll rephrase the question. That's fine. No problem. It's no problem. These things happen. It was just about, we were talking about protection, how we can protect ourselves. We all know that there are visors, gloves, masks. Could you give us a little bit more detail as to how we can do this effectively?
Sure. I mean, I think the most effective way at the moment is to follow the government guidelines, which is stay at home, only go out for essential shopping, for one day of exercise, and keep to social distancing and wash your hands regularly. And when I mean wash your hands regularly, I mean wash your hands regularly. It will save you in the long run. In terms of what I mean by kind of being at home, is that you can do several things while you're at home. Make sure you've got a good diet. Diet is very important for your immunity. Make sure that you eat well. So those of us that are isolating, the elderly, I think it's fantastic that we've got community organisations that are providing them with fruit, vegetables, food, also medication. Make sure that people are taking their medication. I think when you've got undiagnosed or you've got diagnosed cardiovascular disease, we know some of our elderly in the community. I mean, I know from my mum, she forgets to take it or she doesn't want to take it. It's vital that for those that are on the shielded list or those that are at risk, they need to make sure that they take their medication. So that's a must. If you've got diabetes, you type 1, type 2, you have to protect yourself. You need to be having your regular food, having regular medication. This is absolutely essential because you are at risk. Also, what I would say is asthma. Make sure you've got an inhaler. It's coming up to hay fever season. We know I'm itching like crazy. My ears are itching, my nose, and those are the areas where the virus hops into. So the droplets you can pick up, it'll go through your eyes, your nose, your mouth. So basically, what I would say to people is make sure you've got antihistamine medication, things like cetirizine, Claritin, Bakayi. Have it ready, because what you don't want to be doing is if you go out, you start rubbing your eyes, you start rubbing your nose, and then you put stuff into your mouth, and then you get transmission. So you just protect yourself that way. In terms of other things that you can do, we're talking about hand sanitizers. No good having antibacterial wipes. They're not effective. This is not a bacteria, this is a virus. So what you need to do is to have something that's at least 60% alcohol. So hand sanitizers are great. I mean, just check that they've got 6% alcohol in them. The higher the better. This is what we use in science to disinfect in laboratories. You need a high alcohol content. If you need to buy some, go on Amazon. You can buy surgical spirit, get some aloe vera, and make your own sanitizer. You don't need to buy expensive sanitizers. It really is that simple. But washing hands, wash them regularly, not to the point where it becomes sore and cracked, because then again, that'll be prone to bacteria. Bacteria will impact on your immune system. So we've got to keep our immune system right up to scratch. Now, you mentioned gloves. Gloves are not effective at all, purely because if you go out wearing them, you start sweating, you start touching things, and then you start touching your face. And I've seen so many people, and I've been guilty of it. Tap my phone, somebody's rang me, and you've touched something, and somebody who's infected, you may not know, they may be asymptomatic but still shedding virus. You've picked up something from a tin or a work surface, and you've got your gloves, and you think, oh, I'm safe because nothing's going to happen to me. And then you start rubbing your eyes, you start rubbing your nose, and it's not good. So what I advise is, if you are going to wear gloves, and if you feel that will reassure you, then take some hand sanitizer. Make sure you rub hand sanitizer after you've gone shopping, or if you've been on public transport. I mean, we're not supposed to be going out that often, so I don't think many people will be doing that. But just keep it safe with you. After you've gone shopping, make sure you take your gloves off straight away. Use a hand sanitizer and sanitize the handles of that. When you come home, take your coat off, take your shoes off, keep them in the hall. Don't bring them into the house if you can. I think just be safe about that. Wipe door handles, wipe your phones, wipe light switches, remote control, your laptops, all these kind of things that you would touch. But as soon as you get in, wash your hands. That's the most crucial thing that you can do.
I'm going to move on because we've got some questions. Yes, we've got some questions here about how far should we go to wiping down food that we buy from the shops. Well, I think you need to at least be careful with the bags. But I want to move on to Hussain Hoja, and we'll come back to that question. Hussain Hoja, could you tell our audiences the changes in burial procedures? Because I know we've touched upon this within the Turkish Cypriot community. You've been very great in informing the Turkish Cypriot community about this, but it'd be really good for us to have this in English, what the specific changes are and how we're supporting families through this terrible time, really.
Thank you. The most important thing to convey, first of all, to our public and to our community is that if anybody has passed away who is non-COVID, so who's died from a heart attack or any other causes that are non-COVID, then 90% of the previous procedures will still be carried out. So the body will be washed. It will be embalmed if it's going to Cyprus, hopefully, which is a different topic completely. And then it will be shrouded and put in a coffin. The only thing different is that because the mosques are closed, it's closed. Sorry, all the houses of worship in the country have been closed, and this is government guidelines.
Yes.
So the services are held at the selected cemeteries or resting places. Now, the only thing we have is the family do not have that chance anymore to view for the last time. That's something that's not allowed, even if it's COVID or non-COVID. The second thing is most cemeteries, most of the Turkish Cypriots of London, so if we look at London, live either in the north or the south. Now, in the north, we have a more relaxed rules in some cemeteries. So in Tottenham Cemetery, I think we're allowed up to 10 or 15 members of the family, as long as they observe social distancing and use common sense, of course, come well prepared, masks, no one embracing each other. Lavender Hill, which is another popular cemetery with Turkish Cypriots, it's about 5 or 6 people if it's COVID. If it's a non-COVID burial, I think the max will be probably 10. Trent Park, again, Trent Park is another cemetery that's very popular with Turkish Cypriots. Again, then it's a limit. It's a handful of family mourners allowed. When we look at South London, we have a large cemetery which was opened about 15, 16 years ago, which is called Kemnal Park, Eternal Gardens. There, again, it's a handful of people. Another popular cemetery in South London, which is Grove Park, one of the largest Turkish Cypriot cemeteries, no family members are allowed to enter the cemetery at any given time and are not allowed to observe the burial. The only person who's allowed to observe the burial is the Imam or the Hoja, who will be doing the last rites at the graveside. Even the funeral directors are not allowed to watch the burial. So I think that's one thing that people need to know about. The second thing, message to the community, with COVID deaths, unfortunately, there is no washing. Thanks to Shakrole Mosque, which is the Ramadan mosque run by Erkin Ramadan Güney and his wife Melanie, the bodies are being sanitized. They are being sanitized, not washed, but sanitized. And then they will have the traditional kefan, and all bodies are going into a body bag. Then the procedure would be that the funeral prayer takes place usually at the cemetery or maybe outside the house, if it's possible. But most times, 99%, it's at the cemetery. It's a handful of mourners, very close members of the family who attend. We're allowed sometimes to put a handful of soil into the resting place, and then we all stand back, and then the rest of the work is done by the workers at the cemetery, and it's done by a machine. Then we do a short prayer. Now, the other thing that we don't have, as I said, the mosque is closed, so there is no mosque attendance, the traditional way of sending our loved ones to the next journey. Also, this has affected our traditions of reciting the Mevlid and the Quran after each burial for 3 days, and then on the 40th, none of that is happening. We have arranged at the mosque to do a weekly service. Other members of the public also contacted me, and we are doing Skype or a WhatsApp prayer service to members of the family. But these are challenging times and trying times, and it's very difficult times. We've lost a lot of people in the community, unfortunately, from a different range of ages as well, from 26 to 97-year-olds. So it can affect anybody, and we need to be very vigilant, and we need to be very careful.
Yeah, thank you very much, Hussain Hodja, for that information. I mean, like I said, what you're doing for our community is amazing, and my hat off to you, honestly. Full respect. It's not easy times for yourself either, and the fact that you've adapted and tried as much as possible to support these families day and night. I mean, I know I sometimes talk to you in the middle of the night. I mean, you literally get a couple of hours sleep if you're lucky. So I want the audience to know that, really. And I think the community are very grateful for all that you do. But unfortunately, these rules have changed. And I thought it was very important for you to run through this and reassure our community and our public that this is something that's happening to everybody, and you're doing your best for these prayers to be done, like you said, through WhatsApp, through various forums where you're doing mevlits on a regular basis, and that's how we're coping. But I did like something that you said recently, that these people who have passed away are our heroes, and they are, will be remembered forever, and afterwards something will be done in remembrance of them. And that really moved me, and I thought that was a really good idea. And during the month of Ramadan, we will be hopefully doing a regular program as well about Ramadan and praying and thinking about spiritual things. Hussain Hodja has kindly agreed to that, and I really very much look forward to that. So that's just something else to look forward to. But it is extremely hard times. And Erim, I'm going to come back to you now. For our community, how as a community can we help each other get through this? What do we need?
Yeah, I mean, before I touch on that, I want to say something else about the role of the Hodjas in our community. I mean, as a community, as a culture, as a society, we are very spiritual during hard times, and we rely upon these individuals to give us the guidance that we need, and they've surpassed any expectations we've had as a community. So in the name of the community, I'd like to thank Hussain Hodja and Egg and all the other Hodjas which kind of have filled that void. I think something else has come about to me is that to help the Hodjas, to help the people who are helping our loved ones to the next life, that we need to kind of make sure that we ease the pressure on them and have possibly one person who takes the lead in communicating with the Hodjas in relation to burials and in relation to, because it does cause a lot of problems, it does cause a lot of confusion if we have lots of people coming to contact the individual who's responsible for the burial. I think the second thing is that we also need to be in a situation where we as a community try to ease as much pressure from these religious leaders as possible, in order that they can do the job of guiding us in this hard climate. So I think they're the two messages I want to say related to what Hussain just said, and add to it. In relationship to what we can do as a community, there is lots more we can do. We've said that there's about 5 GoFundMe pages which kind of deal with different aspects of the problem, from the one that the group has launched, which relates to trying to feed the community and trying to help those really in need, right the way through to the Council of Turkish Cypriot Organisations, which is organising a fundraiser for to help families with the burials, and the one that's been organised by the mosque related to the purchase of an ambulance. So I think there's a lot we can do in trying to support financially the individuals. There's also, we are seeking volunteers all the time. The idea is that we try to match the skills that individuals have in the area that they live in with people in need in those areas, so that there's kind of an understanding between two people in contact. If the problem is spotted, then we can deal with it. So we do need people to join us, and at some stage people contact me directly or contact the program to get a volunteer form, fill it in, return it back to us, and then we can try and do best we can. And I think that we need to keep information accurate and not to move it into the dimensions of trying to move it somewhere else. There is this virus which is affecting our community. There is aspects of what we need to do that need to be followed quite clearly to try and deal with this issue. But in the future, there will be a time to ask questions as to how effective has the UK been on this issue, how all these conspiracy theories that are floating around, which
there is a lot at the moment.
So we've got to be focused on, there is a virus that's here. There is a virus that we need to build a community, and we need to support each other. And I mean, I've got to give credit. I've got good credit for all the organisations, because for the first time in the many years that I've been working in the sector, I've seen all the community groups. It doesn't matter what type of service they provide or what type of members of our community they help. They've all come together to try and deal with this virus. The virus is the enemy. We are all one. We are all one community. We are one people. And it's the first time that I felt really proud of the community being able to come together like it has.
I mean, especially I loved your project, and I was very, very fortunate to be part of it, that video that we did to raise funds for these various groups. And that was actually your idea. And I know Gulay worked relentlessly on it as well, editing it many, many times. But that was a real show of how our community
the important thing about that is that, yes, the idea came to us around, we saw all these individuals which represented different aspects of our community coming together to provide. So we said, why can't we portray this in a positive video to show that the community is one community, and that there is one aspect around what we're all trying to do together. And then every person we contacted, no one said no. So everyone was jumped on board. So for me, it's thank you to everyone who participated in it. And it shows that if we as a community embrace each other as human beings, and that we want to kind of help each other, then it works. It really does. And we don't waste a lot of energy on negativity. We focus on the positives of what exists within our community, and we move forward.
Yeah, we have to. We've got lots of comments. We're going to go through some of the comments, and then I'm going to be going back to Fulya. We're going to be talking about vaccines. But I think this one, I'm just going to go to the bottom. Sue's asked a very good question. It's sort of Erim covered it and Hussain Hodja, but maybe Hussain Hodja can just wrap up this question. It says, thank you, Hussain Hodja, for the information earlier. You touch on the subject of help with funeral costs at this difficult time. Can you please elaborate on that? I think that's quite an important question.
Yeah, it's because we've had multiple deaths in families. So there are families who've lost 3 close members. A lady lost her son, her daughter, her nephew. We've had 2 brothers die. We've had a father and a son die, and God forbid we might see this again. And in funerals are not cheap. They're not cheap in the UK. So if there is a need, and if we are contacted by a family who are struggling, maybe these funds could be used to help these families.
Yes, and there are links. We will put links on our program tonight. But please, this program that I do on Wednesdays, I'm just saying this to the public, is about the COVID-19 platform group. It's all about all these different associations. We've all come together, and this is specifically on this. So every time I share out on a Wednesday, all of those groups will be there. And like we said, on all of the different websites and pages on Facebook involved with these groups also have the links. So please have a look at that. But I mean, message specifically to Sue, it will be at the top of my program when I share out the link. But to go back to Fulya, from your scientific perspective, how close are we to a cure or a vaccine?
Yeah. In terms of a cure or vaccine, I mean, it's progressing really, really fast at the moment. I don't know if people watched yesterday's Downing Street briefing. Basically, the Oxford Vaccine Group and the Jenner Institute have already got a vaccine candidate. I mean, there's loads of vaccine candidates at the moment, but they seem to be the most successful group. They've got a lot of funding now from the government to progress this forward. As Mek had outlined last week, it takes 6 to 10 years for a vaccine to come into license, and then it takes production. So this has been absolutely fast. They're going into human trials, I think, this week, which makes it really, really incredibly fast the way it's moved on. So we're talking about 16 to 55-year-olds, and then you have to do a number of clinical trials. There's 4 phases, each one increasing the number of people on these trials. We're looking at dosage, the effective dosage for this vaccine. You're looking at toxicity, because at the end of the day, you don't want to give a vaccine which will cause more harm than it does good, because the whole idea is that we want to have a vaccine that will protect us in the future. So these are all the considerations. I don't necessarily think we'll get, they're saying September, but I think that's really optimistic considering we're in April. I think, we need to know that it's safe. It's safe to give to the elderly, it's safe to give to those with pre-existing conditions and children. So 12 to 18 months, that's still very fast considering that 10 years is the most likelihood. And you've got to bear in mind, it has to be licensed by the Medical Health Regulatory Authority or the FDA in America. And then it has to go into mass production. And when I mean mass production, I mean mass production, like Tamiflu for influenza. So it will take a bit of time. I mean, hopefully within the next 12 to 18 months. But in the interim, there may be some relaxation of the measures. But what we don't want is a spike to happen again. So keep social distancing, wash your hands, make sure that you take hand sanitizers, do all those good practice things, cover your face if you're sneezing, make sure that you wipe up surfaces. On the issue of masks, do we wear masks? Only if you're with somebody who's already sick or you're coughing and you're sneezing yourself. Masks are not that effective purely because if you don't wear them properly, you're likely to contaminate yourself anyway. So taking them off, putting them on. Masks are probably only good in public transport situations like the tube, where you're in close proximity to people. And unless everybody wears it, it's not going to be effective. So when I mean everybody wears it, we all know that some people are symptomatic, but there are loads of other people who may have symptoms, but very mild symptoms, but they're not showing up at the moment. But they'll test positive. So we have to make sure that everybody wears it. So if there's a government initiative that we have to wear those, yes, I think that will be safe for everybody. But at the moment, vaccine, we'll have to wait and see. It's very, very optimistic, but it's good news as well. Yeah, good news. I think this is what the Oxford group has been waiting for, and several other organisations. This virus has been around for a good number of years. The SARS COVID virus. So I think there's been a lot of research on it, and I think hopefully we'll get a vaccine that will work and will be safe to use in the future.
Yeah, I'm hopeful too, really. So there are positives. If I'm just going through some of the comments, guys, and this is open to all of us. Nuria Mertjan is saying, "Together we are stronger." I think that's reference to the video, Erim.
Yeah, although credit's being pushed towards me, it's not me. It's all of us. It's all of us. Yeah. And what Nuria says is very, very true. It's all of us coming together. I mean, at this moment, there's no one body that I've gone to get support for this project that said no to me. So everyone's jumped on board. Everyone's been working together. Even like I have conversations with lots of other bodies like Football Federation, the Conseil, various other ones, and everyone is working together. They're doing their own bit. We're communicating with each other around what they're doing, what we're doing, how we can kind of work it together so that we don't overlap. And it works really, really well.
Yeah, there's lots of people thanking Hussain Hodja. Egg Gunay, I'll call him Egg because that's how he is on Facebook, is saying it's all about love. And I know Hussain Hodja, you've been working very closely with him. How is that? Like, just to lighten the mood, you two cheer me up, you know, with your lives sometimes. You know, you're dealing with such terrible situations, honestly, but yet you brighten up my day when I see some of your videos. I mean, how's that relationship? Just give us a little glimpse.
It's an amazing relationship. It's a very brotherly relationship. I can drive him crazy, and he can drive me crazy. Erim knows that. But yeah, he's a good laugh. But at the same time, he's someone full of emotion.
Yeah.
He's someone who hasn't buried his father. He's still fighting to bury his own father, which has taken 14, 15 years. And on many occasions, Egg does break down, and he shows his emotions at the funerals, and it is a difficult time. I mean, I just go to the funeral and go for preparation, but he's there 24 hours a day with it. So he's my brother. We work together. Just hope no one ever goes between us.
No,
we'd be lost.
Be careful to look after yourself. Because
as a community, we'd be lost without his help and his guidance to families. He's very, very open. He's very open-minded. He tries his best, and he gives people not 100% but 200%. And he's really doing a great job. Him and his wife. And listen, let's not forget about the youngsters there as well. Youngsters who no one sees. His own children are working with him, and that's a lot. And that's a strain.
Yeah, I mean, this is it, you know. So thank you very much to them also, and thank you for coming on and supporting our program tonight. Mehdi Ismet, he'll be coming on Friday. Actually, we're going to be linking into Cyprus. Another very valuable individual, saying, you know, prayer hands there. Everyone's saying that they love you. Hussain Hodja, lots of people saying thank you. But there was a question earlier on before we cut off Fulya, and I want to go back to that because we've been extended. Our program has been extended by about 5 minutes, so we've got a little bit more time. It says, how far should we go to wiping down food that we buy from the shops, Fulya? What's your opinion about that? Have we lost her again? Hello? Fulya?
Sorry, say that again, Aisha.
Right. It says, how far should we go to wiping down food that we buy from the shops?
Yeah. I mean, you can do. I think if you bring it home, just to be safe, you can make yourself up a bleach solution. I don't know, look online, 1 part bleach to maybe 4 parts water. Don't make it too strong. Just wipe it down. I think that will give some reassurance. You know, if you bring in kind of things that you brought from the market, from the Turkish supermarkets or from the supermarkets, just to make sure that it hasn't got somebody else's hand on there where it's been, you know, it may have stayed on there for a couple of days. It may not even affect you, but just for reassurance, yes, I would wipe it down, definitely.
Okay. Ertan Chabi has also made a comment, and I think this is very befitting as we say our last words, because we're in our last 5 minutes, and he's put here, we have to make sure this great collaboration and togetherness continues after the crisis. Thank you all. I think that's a very valid point that we've learned from this situation and this pandemic, and it's very important that we carry on this togetherness as we move forward. Erim, would you like to tell us your last words, because we're in our last 5 minutes?
I mean, I'm quite blessed that we have really strong community leaders working on this project and all the other initiatives that are happening around us, because we have these individuals that are quite good in their own relative fields, and they are stepping up, and everyone's stepping up to the moment. I think outside of the context of what we're doing, there is a lot's happening with other communities. So there's other communities which are looking towards us for guidance around how we set up the scheme, how we set up the project to be able to support us on this. And there's lots of other organisations and individuals which are key to our community. For example, Absolute Print donated 60 visors to us, which they're creating through 3D printer. So that came through to us. There's loads of other people which are kind of saying to us that we're prepared as a restaurant to give you guys food, because that's what we do, and you guys can make a connection for us with elderly who need it. So the community is really stepping up. It's not just it's not just us as community leaders and the various groups that exist, but individuals within their own businesses, individuals that are kind of wanting to do their extra little bit. So we've had dressmakers who have said to us, look, we've got all this material, you just give us a template of what you need and we'll do it. So we're getting bags arranged for our carers that can be used for putting their items in when they go to people's homes. So from my perspective, it mirrors what Ertanç says. We hopefully this will continue well beyond this virus. But as for the moment that we're in now, I'm really, really amazed by how people have come together.
Yes, I am too. Yeah, it's so, although it is hard times, there are positives. I think we've learned the worth of what's important in life. You know, when you make things a little bit simpler, I think it really does magnify what truly matters in life. And I think, it will be a learning curve. Yes, lives have been lost. People have been very sick. But I think at the same time, having that time, because we're all rushing around, to actually have that time to sit and think and understand what's important has really helped us come together as a community. And I think that's what resonates tonight. Hussain Hoxha, what would be your last words to our community?
My last words to the community is that as we approach the eve of the holy month of Ramadan, which is a month of reflection and a month of sacrifice, where millions of people across the globe will be going without food and water from dawn to dusk. Yes. And it's a hard time because our mosques will be closed, but the doors to God are never closed. So we should also use that time to reflect. And our community, they might not be the most religious community, but they are a spiritual community. And please, whoever's watching, make time to reflect upon in Ramadan. Care for your neighbors, care for our elderly, sit down, pray for our deceased, give in charity. There'll be a lot of fundraising in Ramadan. And we have to remember that the coronavirus is not affecting only our community, it's affecting communities across the globe that are poor already. So I have contacts in Bangladesh. People haven't been to work for 4 or 5 weeks. People are on the point of starvation in Africa. Let's remember the people in Yemen. They're suffering from a civil war, and now they have the coronavirus. Let's try to send our donations to these kind of people, and we can do that in the name of our deceased, in our loved ones, to have our children blessed. And remember what Allah says in the Quran, because the coronavirus has made us all wake up. And I totally agree with Ertanç abi. Hopefully after this, we will be a more united and more loving and more community with more tolerance as well. Because the Quran reminds us of our duty towards our fellow human beings. When he says to us, I created you from one man and one woman, from your father Adam and your mother Eve. And I created you in different colors and creeds and tribes, only that you recognize each other. And what has coronavirus done? It's made us recognize that this can affect anyone, and it's brought communities together. Let's pray for tolerance, love, and peace to prevail across the globe.
Yes, it's fantastic words, Hussain Hoxha. And Ramadan starts on Friday for the Turkish community and Saturday for the rest of the community. And like I said, I look forward to having a regular program with yourself during the month of Ramadan. I really would like that, just so that we can put some of these spiritual messages and across to our community and give them some faith. And it is going to be hard to be fasting during these times, but we must do it. And I'm determined to do it this year as well, all the way through. So let's see. You're going to have to keep me going. Fulya has come back. Have we got time? A sound, Fulya, from you?
Yeah, I've got sound. Yeah,
oh, brilliant. Your last words for us. We're on the last couple of minutes of our programme.
Okay, last couple of minutes. Just to say, stay safe, everybody. Try and adhere to the guidelines. It is scary out there. There is help on hand. There is support available. Please use all resources. We've got great community. We've got Hussain Hodja. We've got Erim. We've got other community organisations. We've also got lots of local authorities who are working with other community groups to support you for your medications, for food. So don't feel you're alone. It is a very distressing time at the moment. There is help on hand. Look at the council websites. Yes. There is support available. Please do not think that you are alone. We are all here to help. We are all here to help. And
that is a very important point that obviously we couldn't touch upon earlier, but you were saying that services are still available. Yes, they're limited. Yes, where needed, you are getting prescriptions and a diagnosis over the phone via doctors, nurses, specialists. But if there is a real need, you're not alone. There are some, because like, for example, we were saying with the sexual clinics and things like that, you can still get in touch. Yeah. There are numbers that people can go if they want to actually see someone physically. That's still available, isn't it? They just need to look at the websites, do they? Okay, brilliant. I just wanted to make that point. Mm-hmm.
Yeah. Services are reduced. We are working to reduce capacity because of social distancing.
Yes.
But you can get access to services via the phone, telephone assessments, triages. They will see you face to face for emergencies. So please don't think that you can't access services. There are services available.
Okay, brilliant. And just in the last couple of minutes of our program, there's still comments coming in, so I don't want to miss anybody out. Funda is saying thank you. Hussain Hodja, Erim and Aishen, thank you very much. So they're so appreciative. Hi, Leah and Larchok Güzel. That's just basically in translation. Good broadcast and very nice. See, I can do a bit of translation there, but I mean, it's nice to end on a positive. Hopefully we'll do this again. Like I said, Erim has set this up, and every week the themes may differ, but it's all part and parcel of the COVID-19 Turkish Cypriot platform group. So we'll be updating you every Wednesday on this program as to what's happening. Please follow the links if you want to donate towards any of these charities to do with the funerals, to do with the ambulance, to do with COVID-19. All the links will be up there. And if you want to volunteer for the voluntary group, contact Erim, contact myself, contact Eurogenç, contact the links. Is there anything else that anyone specifically wants to say before we draw a close to the program?
No, I think you've covered it all.
Okay, brilliant. Excellent. It's been great having you all on my program, and hopefully Hussain Hodja will be doing it on a regular basis during the month of Ramadan. Erim, we're going to be seeing each other again every Wednesday as part of this group. And Fulya, please, if you have any updated information, then you're more than welcome to come back and update us with anything to do with the vaccine, especially, because I think that's very promising news. Thank you very much. Thank you for all the viewers and for all the comments. That's it from us, from Eurogenç TV. Have a very good evening. Goodbye.
Welcome, we are Bologna, calling newlyweds or those looking for a new bedroom set. Venti 5-door bedroom set is not only glamorous and modern, but has storage inside the bed. This bedroom set was £3,700, now £2,395. Bologna, we are here for you.